Thank you for tuning in to the Parma Area Chamber of Commerce podcast. We will be focusing on everything from spotlighting our members to discussing what is happening in the chamber. This episode is brought to you by Idea Cleveland. Idea Cleveland is a proud sponsor of all the efforts of our chamber. Now, let's join the conversation at the Idea Cleveland studio in Independence, Ohio.
Hey everyone, welcome to another episode of the Parma Area Chamber of Commerce podcast. I'm Chris Inman with Idea Cleveland, and joining me today is
Maureen, Shannon, Hospice of the Western Reserve.
Awesome. So many of us know about hospice. Why don't you tell us a little bit about it in case you didn't hear about hospice before?
Okay. Well, first of all, I'll tell you a little bit about our agency. We have been around for over 40 years, and we are a nonprofit, community-based organization. We have 2 inpatient facilities, which is on East 185th Street, known as David Simpson Hospice House. And we have the Ames Family Hospice House, which is off of Crocker Road in Westlake. So in the event if any of our patients where they're being cared for have symptoms or issues going on that can't be handled in the current setting, then they go to one of the inpatient units to make sure that they get their issues under control. And specifically for that reason, the staff at these inpatient units are specifically trained for hospice care and pain management and agitation and so forth.
Yeah, when I think of hospice, I think of like pain care at the end of someone that's battling cancer.
Sure.
Is that generally what hospice helps with?
Yes, it is. Okay, first of all, we have a benchmark that we always use. If that somebody comes onto our services, they live for 6 months or less. That's the projection. However, that doesn't mean that you come off the services if
you're not kicking anybody off.
No, we don't kick anybody off at all. Anyhow, and so we do have patients that have been on for a couple of years because they meet the criteria. And we also have patients that graduate because they stabilize from the wonderful care that we've been giving them, and they can go off, but we still follow the patient.
Interesting. So you've had patients there. I always think it's like a pain management at the end of life. I guess it's more than that.
Well, it's a lot more than that because we provide several disciplines for each patient. So consider spiritual care, a hospice nursing assistant, you've got a social worker, you've got the nurse that's assigned to that patient. So there's about 9 different disciplines. Volunteers play a big part in what we do. And so each story is made for each individual on what their plan of care is going to be and how they're going to be taken care of. That is set up specifically with the patient, the family, or the facility staff, whomever. And we go ahead and we base the needs of the patient on how that plan of care is going to look. So that can change. It can become less frequent, or it can become more frequent. So the most important thing is to make sure that the patient is comfortable and pain-free.
So does traditionally do medical professionals reach out to you and say, I have someone that's in need of hospice care? Do families reach out to you? Who creates that beginning relationship?
Well, anybody can. That's very important to know, too, is that anybody can refer to us, whether it's a family member or whether it's a doctor or a social worker in a hospital or a facility. Anybody can make the referral. And it's a pretty, relatively simple process. And then once the referral is made, then our teams go ahead and kind of lift it up and do what's ever necessary to get doctor's orders and that sort of thing. So, and then you have a team of people that, really put their arms around a patient on different occasions and so forth, not literally, but...
It's a great metaphor, though.
Well, it is, and that certainly is what we do as an agency, is really try to embrace each and every one of our patients and fulfill the needs of them and their family.
It's awesome. Now, unfortunately, we live in a healthcare system that cost is always a factor.
Yes.
So how does cost factor in to our hospice care?
Okay, well, what happens is that when a patient qualifies to go on hospice, Medicare and Medicaid pay for hospice, and most private insurances will pay for hospice care. So what comes under that is that our agency will provide all the durable medical equipment that a patient is requiring, because it varies from each individual, and oxygen and so forth. Mm-hmm. So private insurances will pay for it. I say most because I don't want to say all, but definitely Medicare and Medicaid pick up the costs for that. So it makes it much easier for a patient to come onto our services knowing that they're not going to have these overbearing costs on them. So
interesting. And then you say you're a nonprofit, so you accept donations as well, right?
Yes, we do. Yes, we do. We have our famous Walk to Remember every summer. It's usually held at the zoo. We had to bypass the 1 year because of COVID. And so we did have it this year. But we usually have that as our main fundraising effort. Now, other people can sponsor events and fundraise. Third-party fundraising has happened. And we just look for our donors, and businesses and private entities will donate, individuals will donate. And so that leads us into where we have a pediatric hospice program. Mm-hmm. And believe it or not, the pediatric program is not covered under insurance. But that doesn't mean we won't take patients. We'll take patients, and we have the funds to try and maintain and their care for as long as they're with us. So
that's nice.
So
where can we learn more information, be it make donations, or if we have a loved one that maybe we're thinking about maybe is in need of hospice care?
Well, there is a number that I will give you. Excuse me. And you can call this number, and somebody, of course, will answer and then take down the basic information. And 9 times out of 10, you'll get a call back and try to get arrangements set up for the nurse and the assessment team to come out. And so we try to make that process as easy as possible, because most of the time people are in some sort of difficult period.
Yes.
And so we want to make that transition as smooth as possible and relieve the caregivers or the patient from any of that responsibility. So we'll take care of that.
Interesting. And what is your website?
Our website is hospice, HOSPICEWR.org.
Excellent. Thank you so much for joining me. And thank you for watching today's episode of the Parma Area Chamber of Commerce podcast. Make sure you subscribe so you get notified when all the new episodes are released. Have a great day.
Thank you.
Thanks for listening to the Parma Area Chamber of Commerce podcast. We would like to thank our sponsor, Idea Cleveland. Please subscribe to our podcast to be notified when new episodes are released.